Sounds good, man.
So what's up, world out there? I hope everybody's doing on this wonderful Saturday morning. And as always, we always have our good friend right here, right with us on this podcast, William Bridge. Dr. William Bridge, how you doing, William?
Hey, Juan. How's it going, man?
It's going pretty well, man. I was thinking about you the other day, because we haven't talked in about a week and a half, maybe 2 weeks. And I know that you've been at the hospital, and I know you have a big role in the hospital. You do a lot of great work in your community and for the healthcare system at large. And, with the whole coronavirus pandemic, things have really changed in the last couple of weeks, huh?
Yeah, that's for sure, and I'm sure we'll get into some of the changes. But how is everything different from your perspective? What's changed on your end?
Well, for one, now I'm seeing clients, William, through virtually, and they're requiring us to take these trainings on telehealth. And one of the things I'm noticing is that the system, which is something we've talked about in our previous podcast episodes, and hello out there to the audience again. And one of the things we've talked about in our previous podcast episode is how the system, and it's such a coincidence that we did this about a month ago, William, the system sometimes has difficulty in adjusting when things present themselves. And it isn't set up necessarily for patient care. And now this coronavirus has really challenged the system. And it's seen in my agency where probation clients that really need intensive outpatient, all of a sudden they're required to be disciplined and engage in therapy virtually. So sometimes I'll still find myself going to the house geared up with the mask and the gloves just to be able to provide therapeutic services. So it's changed a lot, man. And it's really exposing, William, what I see is the system at large not being prepared to handle crises as they appear. And I'm glad, to some extent, as bad as this sounds, that I'm not glad that people are getting sick or people's lives are getting taken, but I'm glad the system is being exposed to some extent, because it's always about money and what can I get, and is there a profit involved? And right now it's being focused on patient care, which is really how it should be set up. So I'm not sure how it's changed on your end, though.
Yeah, I mean, I think that one thing that will be very positive that will come out of all this will be the importance of, being able to prioritize telemedicine in times of need. And that's whether it's an emergency from a natural disaster or, any pandemics or, terrorist attacks or whatever the case may be. I think it has emphasized the importance, not only in the time of need, but also, just as a utility of practice where, if there's underpopulated areas in, Montana that can't get to a psychotherapist, psychiatrist, and, we now see the importance of being able to remote access, provide care, which, I think, after the dust settles here, this will be, a whole new standard of care for different reasons. So, trying to focus on what's positive of everything here, that's something that comes to mind. But, the hospitals, it's a complicated world because as everything kind of shuts down and people stay home and restaurants are closed and a lot of, you know, um, necessities are more limited, the hospitals, of course, become a lot busier. We recently talked about, kind of the mental health crisis and, beds and availability and, some of the shortcomings of mental health. Just recently, I think they shut pretty much every homeless shelter in a 50-mile radius of the hospital I'm at. So I'm not sure if this is something you've seen on your end, but we just have a massive influx to the emergency room for, people with various needs because they have nowhere to go.
Man,
Um,
William, thanks so much. I really mean it. Thanks so much for sharing, because it's not every, you'd be surprised. I'm lucky. I'm lucky, and because you're my friend and I get to talk to you, and I know that you're a very busy person, but there's a lot of people that have no idea what a doctor at a hospital and in your position has to do when caring for these patients. And now with the influx, all of a sudden, an influx of patients going inside the hospital because of the pandemic going on. So once again, thanks for the work you do, man. But I saw, just to touch on that, I'm very good friends. Don't think I'm going around making friends with all the homeless people, because I'm not. I'm not going to act like I am. But I do have a couple, because of the transit I take, that I even know them by their names.
Hmm.
I take pride in that, honestly. And
Yeah.
sometimes I'll give one of them $1 when I know, or a McChicken. If I'm on the way to McDonald's, and I know I'm going to pass by and see this person, I'll buy a McChicken. I know them by names. This past week, I gave them gloves. And
Hmm.
and as I was giving them gloves from my box, like, I'll give them about 5 pairs each. It's only about 3 or 4 of them. One of them told me, "Oh, the police officer just passed by and told me that I can't be walking up to people right now." And I felt bad. And you know what? I didn't even think at the time, because I was in my car. He came up to my windows. I was giving him the gloves, and I didn't ask him, "Oh, where is he sleeping now?"
Hmm.
And you just made me realize I should have asked him that. Not saying that I would have let him sleep in my house, because there's no room and all that, but I now I'm wondering, from what you just said about them closing the shelters, but they haven't closed the shelters here, not the
Really?
adolescent shelters,
That's good.
which is weird, because Miami-Dade County is right behind New York as far as total caseload. I think New York and New Jersey, it's right behind. I think it's number 3. At least that was a couple days ago, and I'm sure it's gone up.
Yeah.
Um, so, William, I'm really glad you got on, because I asked our audience sent us a lot of questions, and we just wanted to get to touch on them and just give your opinions on each one. And we're going to have a conversation about each one. And so let's see a good one to start off. Look, Jason Garcia wrote to us: "With so much focus on the virus, people are forgetting the importance of their own mental health. Are you seeing this in the field right now? And what are you noticing?" So Jason's saying that there's a lot of focus on the virus. There's a lot of focus on the physical component of health right now, about symptomatology in relation to the virus. But he's seeing that as the virus cases increases, which is, I'm assuming, what Jason is saying, he's seeing that people are acting more erratic and restless, and starting to experiencing symptoms of anxiety. Maybe they don't meet the diagnosis, but they're experiencing some symptoms. And all of a sudden, for example, alcohol sales went up 50%. Are you seeing this right now in the hospital as patients are coming in and out, William? And I'm going to give you my take as to what I'm seeing in the street, because even though there's a lockdown here, I still have to go to the street, so
Sure.
to provide services. So what are you seeing in the hospital?
So, I mean, I certainly from the consult side of things in the emergency room, there are quite a bit of what I would say almost like pandemic related anxiety. But some of the other things that I'm seeing, and this is probably going to evolve further because I think that we're still somewhat early on in the stages. You know, you're kind of seeing, and I'm coming in contact with a far different acuity of patient, and what I mean by that is, some of what gets admitted to the hospital from a mental health standpoint is, severe depression or decompensated or psychosis from one standpoint or another. But now what you're seeing is the, very functional, contributing to society. All of a sudden, their lives get uprooted with job loss. And then, what is kind of lingering not too far behind the spread of cases is, unemployment and all the stress that goes along with that. So I think that, we're having almost a kind of a smaller pandemic of, acute stress reactions to what's going on because people are scared. You have this pandemic spreading pretty viciously throughout the world. But then what you have is kind of the aftershock of everything, the disruptions in school, job, socializing. And, I think that although it might not be in the forefront, the mental health side of things is not too far behind. So I wouldn't say it's been forgotten. I just think we're kind of looking at it now from a different angle. But what is your take on it?
I'm, personally, and I appreciate Jason for the really good question. For example, yesterday I I went to see two clients because, as I mentioned earlier, I have probation clients that I work with, clients that are under probation, and with these clients, I telehealth becomes a lot more difficult. They don't have computers, they don't have, even for one of them doesn't even have furniture in their house. So I go to the street, and I happen to also stop at the Publix here, and I have the whole kit. I have the gloves on, the mask on. I have a sweater on, despite it being Miami. It's super hot, and I'm seeing people start becoming a little bit more restless. And
Yeah,
it's not something that I can just say, oh, this person did this, that, and this, and that's what's making them restless. But I can see them. They're restless. They're looking at people weird. They're scared. Really, is what they are. They don't know where the
sure.
virus is. It's not. It could be seen, but people are looking at each other weird. They're keeping a safe distance. And to answer Jason's question, or to go with Jason, I'm wondering, this whole social distancing thing is something we've talked about, William, in our past podcasts, how we're social creatures. I wonder in the long term effect if that's gonna manifest itself in other ways. So, but you touched on a lot of good points, William, on how it's multifaceted. There's a lot of variables contributing to this right now, and variables that aren't being experienced at the moment by everybody, such as the unemployment rate, such as the market falling, and not knowing what's going to happen next. So on to the next question, and we appreciate you, Jason, for this.
Yeah, that was a
So
good question.
yeah, someone wrote here, are you guys scared that you can catch the coronavirus by someone's breath? Um, this one's an interesting question, William. Do you want to go first, or do you want me to go first?
Yeah, I could jump in, and I'd like to get your thoughts on it as well. I mean, I think that you know, for example, if we have somebody that is in the hospital, um, that comes in with respiratory symptoms, and usually what mean is cough, maybe low grade fever, um, and myalgias like muscle aches, fatigue, and this has been going on for a couple of weeks, and you think that they meet criteria for getting tested for coronavirus. Well, that test is being resulted, or it's pending in the lab. That can take 24 to 36 hours. We put them on what's called like respiratory isolation, meaning that technically, in the respiratory droplets, if somebody sneezes and, for, uncertain circumstances, you end up, inhaling those respiratory droplets. Technically, that could be a way where you, transmit the virus. So it can be through respiratory droplets. Now, breathing, if you're talking about breath, talking with somebody and there's no exchange of those things, it's good to keep our distance. The reason that 6 feet comes into play is that's considered the maximum extent where the droplets can be projected from like a pretty aggressive sneeze. But just talking with someone and getting the coronavirus, that's not something that's likely to happen.
So, I'm so sorry, William. Just to get this straight, because, and I
Sure.
appreciate, at 2,000 Ravens from IG. This question came from IG. You're saying that when someone's talking, they can't get it unless there's respiratory droplets, which it's just sometimes our audience doesn't really understand. But that means almost liquid from inside your body that comes out, like a spit that comes out while someone's talking. That's the transmittable part. That's, if that gets on the other person, then it can be transmitted like this, right?
Yes, and that,
Yeah.
that's one way of doing it, and of course there's various other ways. You talk about the timeline that the virus can survive on a surface. So if somebody, of course, who has the virus, sneezes, or sneezes into their hand, touches a counter, um, the virus can technically, for a certain amount of time, survive on that surface. And then if somebody touches that counter with their hand and then comes in contact with one of their, you know, mucous membranes, their mouth, their nose, and it's transmitted that way as well. But the biggest reason for the mask is for the former reason we discussed. And again, the 6 feet kind of plays into that as well. You know, if there's an area that you know has been in contact with the virus, you know, more distance is better. But like we talked about, you know, a little bit earlier, you know, you can't. This isn't something you can see, but you see people looking at each other. I mean, even somebody clearing their throat, or you know, a cough that they have chronically from, you know, COPD. You know, these people are being looked at differently nowadays, unfortunately, and it's just, you know, part of the widespread fear, I think.
And man, William, you give, man, like always, you give, I really mean it, some good information. And at 2000 Ravens and the audience out there that's listening, you heard it here. It's not that you're talking to someone that you can get it. It's if the respiratory liquids or just saliva, just to put it, comes out and it can touch either the surface or the person, and then it can be transmitted. It won't mean that it will. It can. The possibilities go up, and the coronavirus can survive on the surface, and that's why they're asking for you guys to wear gloves and dispose of them properly. And I think that's an important part that they're not putting on these procedures. But what it can last on the surface, and if you're not wearing gloves, if you're not taking the proper precautions, then you can touch it with your hands and then touch your face, and then it can be transmitted. Probability goes really high up. So that's why they're saying the 6 feet. Thanks for that, William, by the way. I mean, there's not
Sure.
really much I can add to that because, I mean, you put it down like a boss there. So we have a lot of questions, William, and I doubt that we're going to get to all of them.
Sure.
But just to add to the 2000 Ravens, this is fairly new to the medical community and to therapists because, you know, Dr. William Bridge over here, he's from the medical community, but as a therapist myself, this is fairly new. And I just want to make sure everybody understands it's not like they ever taught us how to use gloves. There's a proper way to dispose of them. There's a proper way to use of them. And you have to, just because you're wearing gloves, that doesn't mean you touch everything, neither. So I really suggest you do some research because there's a podcast, there's no visuals, but I really recommend on that, guys, okay? And thanks at 2000 Ravens for your question. So here I have Anna Lorenzo. She is on Instagram, but I took her name down. How do you think big city people are going to react or respond as the days go on? So, William, if you don't mind, I'd like to take this one. And
Oh,
this
for
is
sure.
a question where she's obviously saying that people in the city, well, you see, human beings, we were meant to live in groups.
Mhm.
Our ability to be social allowed our brains to evolve, especially the language section of our brains, and everything's interconnected. But we weren't meant to live in cities like this one that I'm living in right now. I'm looking at a big building straight out my window, and everything being so compacted. And now everybody's being asked to stay at home, and the streets are empty, and there's so many people in a confined space. And I'm guessing that she's wondering if that's going to make people react a certain way as the day goes on. I don't have any research, Anna, and I don't have any sort of data to represent or say anything concerning that. What I will say is that I'm already starting to see some people become a little restless, and people have to remember that they have to focus on what they can control. And right now, what's in their control is staying home, making sure that you're not putting yourself at risk at getting the virus, and also spending time with family members. Because I'll tell you what, I'm noticing that the divorce rate in China went up while the coronavirus incident was going on. And I'm noticing as well that alcohol consumption has got, or at least alcohol purchasing has gone up 50%, which is funny because when people have free time, that lets you know that they're using their free time to consume alcohol, which is probably not a healthy way to go about it. And just to add to that, you know, our minds have been wired to always be doing something almost objectively, especially now more than ever in today's age with technology. I'd be, you know, it's maybe a good time for you to take a break from technology for a second, even if it's only for an hour or two, and just put it away and actually try focusing as to what's in front of you, because the constant consumption of information is stressful within itself, especially when the constant consumption of information is negative. It is stressful. So focus on what you can control, and um, we'll see how people respond as the day goes on, as the days go on here in the big city. I'm not sure where you're from, but at least here in Miami, I consider this a pretty big city. So William, I have another one here. This one is from Natalie. She wrote, I feel stressed and annoyed by those I live with. Why is it that the more I'm at home, the more anxious I feel? So she really made this one personal. This isn't really a general question,
Sure.
but um, I think what we'll do with this one is, Natalie, we're not aware of your situation or what's going on at home, but all I want to say is that if your home is supposed to be a place of peace and comfort, and it's supposed to be your safe space. um if you can't feel safe at your home, if you can't feel comfortable in your home, then you really need to reevaluate as to why is that. And is it the people living with you, or is it just that you're having some trouble adjusting to the do nothing aspect of the virus and the uncertainty involved in the with the pandemic going on? You really need to ask yourself that question, because your home is supposed to be uh, a safe space. William, you want to touch on anything there?
Yeah, I would just probably say that, I think, everybody when they go home, they have some, sort of a routine in place. You and I have talked about routines before, but I think what you're seeing, if you know that you have alone time, typically to, clean the house or put away groceries or, get caught up on things, and you're usually home alone from 5 to 7 p.m. And that is now different because people are working from home. I think what you have is, there's going to be a period of adjustment. Um, and even though they're family members, everybody is processing what's going on around them differently. So you have to be sympathetic with, what people don't know. And people are making changes that they didn't go along with, but they don't have a choice. So just kind of patience is key, and just kind of adapt accordingly.
Well, thanks for that, William and Natalie. I hope that touches on your question. Okay, so here we have some really good questions, William. I really didn't notice how good these questions were until I'm looking at them now. How can someone here wrote? I can't pronounce this person's name. It's called Pujadai. She wrote. I remember it was a female. She wrote, "How can I improve my immunity on the virus?" And William, you want to say something regarding this? I mean, I only know the basics. I mean, the basics, which I'm sure it's the basics, but go ahead. Do you have anything to say to Pujadai? And I,
I think that the biggest the biggest improvement to immunity at this point is prevention. I think that you'll hear a lot of different supplements in the vitamin C, and that's all true. And when people travel, they take certain things to help. But I think that the biggest thing is, if you think about it, when you get a vaccine, let's say you get the flu vaccine, that's actually, giving you components of the flu that make it so your immune system can recognize if the flu enters, and you kind of have a prepared, army of cells to take care of it before it becomes a major health issue. So, trying to, kind of prepare your immunity for coronavirus, that's, there are things that can be done to kind of make sure that, you're less stressed, you're better rested, your nutrition is on point. But in terms of, making yourself truly immune to the virus, it's not something that's really a possibility. But it's important to prevent any contact, as we've been talking about. But what's your take on it?
I love that. I love that. You know what? So I'm so glad you're on this podcast. Everybody here in this audience, really lucky. Dr. William Bridge Pajidi. Sorry if the name was butchered, but he mentioned prevention. Stay at home. Make sure you're washing your hands if you do leave. Make sure that you're using gloves when you leave. And like we mentioned earlier on this podcast, know how to use gloves. Just because you're wearing gloves, that doesn't mean you touch everything. All right. And also if there's a lot of information on there on vitamins and drink this, drink that. For example, I even found myself drinking more matcha tea.
Mm.
And we've talked about these herbs and stuff like that before, William. I've asked questions about them, but that will raise your immunity. But the best thing is prevention. And I appreciate that, William and Pajidai. I hope that answers your question. So here we have, is it true that the fear, oh, this is by Wishing. Is it true that the fear and worry are more dangerous than the virus itself? That's a very general question, Wish. What I will say is that this is causing a lot of instability in people's typical way of being. A lot of instability in people's typical way of being because procedures were changed, systems were changed, systems were actually put to a halt. The very systems we created as humans have been put to a halt. Jobs have been put on a halt. There's a lot of question marks around a lot of variables right now, and we don't know how things are going to manifest as the days go on. And this is very scary for a lot of people. So I can see a lot of people struggling at home, not knowing what to do with themselves, engaging, being a little bit more volatile in their relationships. I'm seeing it. And one of the things that I will say is that whether it's more dangerous than the virus itself, that remains to be seen. And a matter of fact, William, maybe I might even look at in one of these questions as you're answering, what is the Baker Act intake right now at the facility? Because I haven't done a Baker Act in a while, but I would imagine that right now, with everything going on, there's a lot more unrest, and so that would be interesting. But I think, William, you mentioned that there's a higher, uh, there's more patients right now and more of an influx at your job, right? At the hospital, excuse me.
Yeah, I mean, I think that's, with the, it's kind of, really two things kind of coming together at once. I mean, I think everybody is fearful about the virus itself, and then fearful for everything that's kind of related to, our change in everyday life. So, I think that's in any terrible situation, there's a healthy amount of fear. If that fear kind of keeps you cautious for, avoiding those things that, can be put off until a safer time, then that's a good thing. So, I think it's not all fear is bad, but it needs to be managed. I think, and I'd like to get your take on this, but limiting the exposure to the news might be a positive thing. I'm not saying don't be informed. However, you do have to realize these 24/7 news networks, it's just, a continuous kind of live stream of, changing information. And it's hard to kind of escape the fact that, there are things being done about what's going on, in any pandemic, whether it's the Spanish flu or bird flu or whatever. SARS, that was kind of the more recent, maybe 2003 or so. There's going to be a period of time where the cases continue to mount. Um, there has to be a pinnacle before you kind of, see things regress. And, the fear can be controlled, and somewhat of the, portion of the fear is a good thing.
But
Um,
you know what, William? I like that because we've talked to this on a lot of our podcast episodes on how sometimes a little bit of stress, a little bit of anxiety is a good thing because it motivates us to be careful about
sure.
things that are dangerous, such as this pandemic, which we should all be a little bit worrisome, and that's why we talked about prevention. But when I mentioned earlier about putting away technology for a couple hours, because you see, people, they don't know how, sometimes they have difficulty um, putting together pieces of information. And
Right.
there's a lot of people saying, oh, right now, since there's social distancing and the ability to be social and our need to be social so important, this is a good time to constantly be in communication and constantly be on the phone and all this. And I think people are grabbing that and they're running with it without fully understanding that if you're constantly on your phone and you're constantly consuming the TV and what they're saying because you are worried, then you're constantly consuming negative information and negative and things that you have no control of. And if I'm constantly on the phone like this, FaceTiming someone 10 hours out of the day because I'm sitting at home alone, then I'm not living the moment.
Sure.
And I'm not I and so when I said put technology away for a couple hours and focus on other things, it was for far more than just consumption of negative news, just because the mind isn't wired to constantly be on a phone, on a technological device all the time. And this is a good time to actually practice and actually depolluting yourself from the constant need to have the phone. Um, so I appreciate that the question, and I hope Dr. Bridge and myself did a decent job in answering that one. So William, we also have so many ones here, and I've actually lost track of time, but we'll go for another 15 to 20 minutes. Are you all right with that?
Sure. Sure.
Sure. So someone here wrote, how to, this is at Cinderella 238, how to feel good during these times. So Cinderella wrote, what can she do to feel good during the coronavirus? And Cinderella, I appreciate you following me because I've noticed that you've liked a lot of my posts in the past. And we appreciate all the people that support us on this. But I think we constructed a self-care menu a while back. And it's a menu that doesn't cost money, but your time. And it says everything from listening to your favorite songs that you haven't listened to in a while, to stretching, to journaling your thoughts, reading a chapter of a book, or starting to read a book that you've been wanting to read for a while, meditating, taking a walk outside. I made this self-care menu when it was in the beginning stages. Now that it's gotten really serious here in Miami, I would limit those walks, cooking a favorite or new recipe, and exercising inside your house. So things that you've been putting off is a good way to feel good during these times, because as our bodies just sit down and we're just sitting, not doing anything in a home or in the apartment, our body craves exercises, and exercise leads to the release of certain neurotransmitters and the opening of certain chakras. So I definitely recommend that. Do you have anything to say, William, um, to the person who asked this question, which is Cinderella?
That was a great comprehensive list, that you had there. So, hopefully, that's something you can kind of make available, or, to your audience, because, it's hard to keep yourself, proactive, in a restricted space. But, I think, reading is, you hear, and talking to people, you hear all the time, like, oh, I wish I could do more reading, that type of thing. But, reading is great because you can go anywhere you want, right? And you never have to leave the house, because you just can be completely elsewhere in a novel, or, whether it's informational or educational, whatever topic you want to read. But, um, I've been ordering and going through a lot of books, just because, when I'm off, I've been staying home more, than I usually do. I usually, I'm out running errands and getting caught up on things, that couldn't be done during the week at the hospital. But, I've been reading more in the last month than I had been probably in the last, 2 or 3 years. Just, it's something that I personally took up. So I think it's a great time, for that. And you can develop very positive habits now being home that even will continue, after this is passed. That you can kind of continue forward. So I think that's something worth mentioning as well.
I should have added on that list that I made there, play with your pet.
That's right. That's right.
Well, and I appreciate that, William, and I appreciate Cinderella for asking that questions. And there was a lot of other questions like that I'm noticing. Like, for example, Mohammed said, how is our mental health being affected during these times? We talked about that, Mohammed. Taz wrote, coronavirus is obviously affecting our mental health. So what can we do to better our mental health during these days? Once again, we just touched on that,
Sure.
Taz. And Senorita said, what can I personally do to help against the coronavirus? And Senorita, it's just that a lot of these questions are overlapping, William. But Senorita, we talked already about prevention. It's not something in specific that you can do, like about curing people or going outside and trying. It's more about staying at home. That's the best thing you can do for yourself and the people around you. Because right now, unless you have a job where you're a healthcare worker or you're working in a hospital or or you're an essential worker, then there's no reason for you to be out there, and putting yourself and others in danger. So that's the best that you can do for yourself. But there is one question here, William, that's a very interesting one. um, will people ever be the same after the quarantine? And this is a really good question because we were talking about that. For example, in just the healthcare industry, I know she didn't mean it like this, but this is just one example for the audience out there. In the healthcare industry, Dade County, Miami-Dade County, which is the county that I currently provide therapeutic services for, they weren't prepared for this pandemic. And I can say that honestly, they weren't prepared for. There weren't ever trainings on telehealth. There was never trainings until now, and now they want to feed you the trainings. Once this is stuff that takes practice, just that providing therapy virtually is way different and requires different skills from the therapist or the clinician than providing therapy in face to face. So that's one aspect on I think the healthcare system's going to change. Counties
Mhm.
are going to be more prepared for when things like this happen. Um, do you What do you think? Or do you think people in general, William, are going to be the same after this? And not just in the healthcare system, but at large, all the systems that are constantly interacting with each other.
Yeah, man, it's kind of goes back to the whole, lightning, doesn't strike in the same place twice because the second time the same place isn't there type of thing. So I think that, the paradigm will be different. So I think people, will change from the standpoint of, probably, what I'm really, really hoping is that, the appreciation for getting outside and kind of, being able to, really appreciate, some of the resources. We've for so long, for so many years, fresh air and going for a walk, has been either put off or taken for granted. You know what I mean? So I think if you've seen some of the statistics about, um, different species actually growing in numbers that were on the endangered list, the pollution level in water with people not being in public is far improved. Air pollution is far improved. So I mean, not to become too philosophical about all of it, but you have to, realize that Mother Nature is really hand in hand with the virus. So I think at the end of all of this, one of the things that can really be, respected is the fact that maybe we have to. take a different approach to, protecting the planet. And, I think a lot of good and strong people will evolve and potentially even change a lot of their ways after this. So I think that, people won't be the same, but it won't be for a negative reason. I think that it'll be from an experience and kind of looking ahead. The next time there's any kind of, you know, bird flu or different strain of H1N1 or whatever the flu may be, there's probably going to be far more, hypervigilance and awareness about what's going on, and anxiety will follow that. But overall, I think, we'll change for the better here.
And people will be more aware of that reality can change at any given moment. The world that we're experiencing can change at any given moment. The rules can change, because I've never, at least in my existence, William, 29 years, I've never experienced something like this. And I never thought it was possible for all the systems like this to shut down like this. I just didn't think. It was never something I've experienced before. But now people are aware, hey, things can happen, things can change. I need to be prepared. And yeah, Mother Nature, this has been good for her, and all the living forms on the planet too, that, like you mentioned, about the less pollution, endangered species. All of a sudden you're seeing a couple of them, more of them, and they're behaving differently. Actually, just to, this is not something I was planning to bring up on this, but the panthers in the Everglades are actually behaving a little bit more differently than they typically do. I was reading an article on that, because they have collars on them since they were endangered here for so long. They have now collars on them, not on all of them, but there are a few panthers, and they're behaving differently. They're getting together and everything. So I wonder why that is, but whatever. That's a different podcast, and I'm not an expert on that. So, but I appreciate that, man, and I appreciate the person who asked that question. So I guess we'll finish with this last question. And by the way, that was Red Rum. I appreciate that. So let's talk about, this is the last question we'll take, William, and I guess we can finish with it's healthcare related. And I think I had mentioned this question to you before we went on. It says, thank you, by the way, Lisselle. It says, is there still mental health help like counselors, psychologists, or something out there working, or is it less than normal? And I guess we can finish with this question, and we'll take turns. William, I'll go first, just to let everybody know, I'm still, as a therapist, I'm still providing mental health services. I'm still going to people's houses. I have to take the proper precaution. All the clients are 6 feet away minimum as we're providing the therapeutic session. I have gloves. I have multiple boxes of gloves. I take fresh gloves every time I'm going towards the back of the person's house or out or back out. I take them off. I have masks, and I rather do the counseling sessions virtually, but sometimes clients don't have the means to do it virtually. What happens if a client doesn't have a computer? It happens more often than you think. What happens if the client doesn't have a phone? It happens more often than you think. And the court systems are shut down. So there's a lot of uncertainty among my clients as to what's happening with their cases and when is it going to be done. And probation was supposed to be done already. And they're wondering and asking these questions. And these questions are serious questions, because the longer they're on probation, the more chances they have of making a mistake, and they're aware of that. And and just like I think you've used this analogy before, William, the longer a police officer's behind you, the more chances you are of just making a mistake. It's just the way it is. And so, at least from my side, and here in Dade County, therapists are still providing therapeutic services. And a lot of us are learning as we go along, because telehealth is not something that the community here, the therapists here, are too accustomed to. So, but I know it's different in the hospital. And William is an awesome doctor. William, what do you think about the question here? And I'll read it to you one more time, okay? Lisselle asked, is there still mental health help like counselors, psychologists, or therapists, or is it less than normal?
Yeah, so I think that, of course, the hospitals in the inpatient setting. So if you're in a, terrible situation and need to be seen in the emergency room, nothing has changed from the standpoint of, being able to see, a psychiatrist, in consults in the emergency room. And if you need to be admitted to the hospital, nothing's really changed from that perspective. All of our outpatient clinics, where, you can schedule appointments, they were closed for about a week, and then they implemented telepsychiatry or telemedicine services. So, nothing's going to replace a face-to-face visit with, no concern of viral transmission in the room. But you kind of just have to, kind of scale back and understand this is going to be the standard of care for a while. And if it's, remotely via, Skype or Zoom or, WebEx, right now we're on Zoom. But if you don't have computer access, then it goes to phone, and if, it's done over the phone, then, it's not going to be good as inpatient visits or face-to-face visits. So you just kind of have to adjust to, the shifting of what's going on here. So I think that there was a delay, and from that delay, there's a little bit of a backlog, but everybody that's in mental health is working on overdrive and, trying to see and address as many patients as possible. It's just, there was a backlog from a time when we couldn't access patients, and the hospitals are somewhat overwhelmed. But, I don't think by any means these services are going anywhere. If not, it'll probably address the lack of providers in the area and probably get even more access to patients. But time will tell on that. But
Man,
that's another good question.
yeah, man, the audience really sent us some good questions, and I appreciate the audience out there. I really appreciate you guys. You guys sent some awesome questions. And William, I appreciate you so much, man, because you take time from your busy schedule to join us and do this podcast and provide great insight to the audience, provide great information and amazing information as to what's happening in the hospital, firsthand experience, firsthand knowledge, firsthand everything, man. And I appreciate you so much. We appreciate you so much, the audience and myself. And we really appreciate you so much, William. Keep up the good work you're doing in the community, all right? And I look
Thank
forward to
you,
doing
Juan.
one of these with you soon.
All right, man. Well, stay in touch and stay healthy, and let me know how you're doing, and we'll talk soon.
Will do, William. I appreciate you, okay?
All right, man. Take care.